Hello?
Hi, Mr. Greeno.
Yes.
How are you doing today?
Good.
Good. Feeling a little tired, sore after surgery?
Very.
That's normal. Well, I'm Dr. Ellis. I'm your pulmonologist. I'm here to talk about the pulmonary function test that you did beforehand, your COPD, and breathing exercises we're going to do in order to make sure that you are breathing effectively while you are here. Do you remember what COPD is, or?
What is it?
No. Well, you do have emphysema, so from all your years of smoking, the smoke you have little grape-like structures in your lungs called alveoli, and over the years after smoking so much, that smoke comes in and it destroys the walls of those, making it harder for you to breathe. So you're going to feel short of breath, and your oxygenation isn't as good as it should be. And also with COPD and emphysema, you have trouble getting air out. So, not always do you feel like you can't get air in, it's just getting the air out. So, a lot of times do you find yourself tripoding, like bent over, like holding on to stuff to kind of catch your breath? Do you find yourself doing that? Yeah, so that's part of what we're going to work with today is getting those deep, effective breaths, okay? And also, do you remember the pulmonary function tests that you did before? Kind of?
Kinda, I don't remember all of them.
Okay, well, the first one was your FEV1. So that's the one where you take a big deep breath in and then you blow out as much as you can in 1 second. And the other one is your vital capacity, where you take the breath in and the biggest breath you can take in, and then you blow out as much as you can. That looks at just how much volume your lungs can take in. Those are the two main numbers that we look at. So for most people, you like above 80%, but with COPD, those numbers are going to be a little lower. So yours came back as 70%, which that's consistent with the moderate COPD that you have. So we usually do those pulmonary function tests before and after your heart surgeries, because it's such an extensive surgery around the lungs and the heart that we want to make sure that there's no damage to your lungs during the surgery. And also because your COPD, all that extra air trapping that happens, we don't want to cause any more pressure around your heart, since it's already been worked on so much. And this will help you get these breathing exercises that the respiratory therapists are going to come in and do. Those are going to help you take those big, effective breaths, okay? So to get that air out, to make sure, your lungs don't collapse, you don't get pneumonia or atelectasis, because, I'm sure you're in a lot of pain right now, so it's going to be hard for you to take those deep breaths, So we're gonna have first do the IS, incentive spirometry. If you don't reach the goal with that one, we're also going to do the Ez-Pap. So do you have any questions about those?
How long is this going to take?
Well, if we start off with the IS, our protocol is you do those for 48 hours after surgery. If you don't do well and reach your goal with the IS, then that's when we go to the Ez-Pap. So once you start, and we'll do the Ez-Pap as long as we need to. So you will start knowing that you're doing better that when you're reaching the numbers that you need to get, and then you can get up and move around, you're coughing effectively. Once we see that you're doing well with the Ez-Pap, then we'll go back to the IS. And once you're reaching your goals, then we'll be doing the IS for 48 hours, okay? And then in a few days, when you're starting to feel better and you're not in as much pain from the surgery, we're going to redo the pulmonary function testing to make sure that you're still at your baseline.
Okay.
Do you have any questions?
At the moment.
Not at the moment? Okay, well, the respiratory therapist will be in here shortly to see you and start those breathing exercises with you, okay?
Thank you, doctor.
All right, good luck.
Hello?
Hello, Mr. Greeno. My name is Sarah from the respiratory department. How are you today?
I'm a little tired.
That's to be expected. Can you verify your first, last name, and birth date for me, please?
John Greeno, November 21st, 1952.
Great, thank you. So Dr. Megan ordered an incentive spirometry therapy for you. Have you used one of these before?
I think so.
Okay. Well, breathing can be hard after you have surgery with COPD. And you may find that you're taking small, shallow breaths while you're laying in bed. And this therapy will help open those lungs up. When you're taking your small, shallow breaths, you're more likely to have fluid buildup or mucus buildup, and you get infection like pneumonia. So with taking these deep breaths and exercising your lungs will decrease the risk of that.
Okay.
So, and it'll make it easier for you to breathe. So this here is your incentive spirometer. You have 2 pistons and a mouthpiece, and this is your goal marker. And you'll know you're taking your good, effective breaths when you can keep this piston here in between the good, better, and best. And then this will show how much volume in the second piston area.
That's a lot.
Yeah, we probably won't get up here.
Okay.
We'll try. And so first, I just want to take a quick listen to you and assess you for a moment. There you go. Just relax your hand. I'm going to take a listen to you. Do you mind?
Okay. How'd they sound?
It's not too bad. We're going to work these lungs out.
Okay.
There you go. Okay. We're going to take 10 deep breaths. What I want you to do first is take a few deep breaths normally.
Now?
Yes.
Oh, okay, well, ask me to forget sometime. All right.
And then I'm going to have you exhale, get all that air out of your lungs. We're going to use your teeth and lips to make a tight seal around the mouthpiece and take a slow, deep breath through the
In.
mouthpiece. In.
Through the mouthpiece.
Big breath in. Okay, let me see. You want to think like you're drinking a big, thick milkshake. So this would be your straw. You're going to wrap your lips around that, make a tight seal. Take a deep breath in. You're going to try to hold it for a couple seconds and then let it out. Big breath in. Big breath in. Okay. Okay. Take you a second. Are you having any pain?
No, I'm lightheaded like you said.
You're lightheaded? Okay. Take you a minute. Get yourself together. If you're having any pain, we can have you hug this pillow around your belly. And as you pull that, hug that around your belly, that'll kind of help with the pain that you may experience. Let's try it again. Remember, put your teeth around the mouthpiece, use your lips to make a tight seal. Take a slow, deep breath in. We want to keep that piston here. See how you do. Try it again. Big, big deep breath. Big deep breath. Okay, okay, take a break. Well, Mr. Greeno, this therapy didn't go as well as we hoped it would. So we're going to have another therapist come in and teach you how to do an Ez-Pap. Do you have any questions for me?
If I'd done better on that, I wouldn't have to have the Ez-Pap.
Right. We're going to have you try the Ez-Pap, and then you'll step down to this one before you're done with these breathing exercises. Okay? All right. Well, thank you so much. We'll see you soon, okay?
All right. Hello.
Hello, Mr. Greeno.
Yes.
Hi, my name's Patrick. I'm with Respiratory. How are you doing today?
A little tired.
A little tired? I heard we had a little problem with the IS earlier. Couldn't quite muster it, huh?
Not as good as I guess everybody wants.
Oh, well, that's all right. We got something here called Ez-Pap that we're going to try now, okay?
What is that?
Well, this is another breathing exercise like the IS, except this one here is a volume expansion. I'm just going to put this on your finger. Monitor to you. And what this is this has pressure coming out of the wall, okay? So we're going to hook it up to air, and it's going to go into this little piece here. All right, and you're going to put your mouth around it like you did with the IS, and you're going to breathe in and out through this kind of like a snorkel, like if you've ever been snorkeling before. Yeah, so you're going to breathe in and out kind of like that, all right? Except when you breathe out, you're going to feel a lot of back pressure, a lot of pressure that you're going to be pushing against. And when you're doing that, it's going to raise a little manometer for us, and it's going to tell me how well you're doing. We're going to be shooting for about 10 to 15 on this little manometer, okay? And that's going to be the goal that we're going for.
How many times do I have to do this?
Well, we're going to do this about 15 times, 15 breaths, I mean, okay? And we're going to do this about every 4 hours until we start seeing some improvement. And you'll notice improvement by increased aeration we'll be able to hear when we listen to you, better oxygenation. And this is basically because of your mild to moderate COPD and the heart surgery that you had. You're not up moving around, you're not using your lungs like you normally are. So they can tend to sometimes fill up with a little bit of fluid, cause atelectasis, which can possibly lead to pneumonia. So this is all a big exercise to help keep your lungs normal and healthy while you're laying here in bed until you can get up and move around. Sound pretty good?
Okay.
All right, I'm gonna get this set up, and then I'm gonna listen to your chest. I'm gonna see what I hear in there. We'll just get a new one of these. Here we go. Right here. I'm just going to set this here, and I'm going to listen to you for a little bit, okay? Sound a little diminished in the bases, which is to be expected after surgery. Okay, so I'm going to turn this on. I'm going to set a little goal for you, okay? There's that. Okay, so like I said, you can hold this with your hand here, put that in your mouth, and when you breathe in and out, you're going to see this little red line start to go up, okay? And we want the red line to hit this black O-ring, okay? Now, some of the things that you might notice when we're doing this exercise is you might become dizzy, maybe a little lightheaded, a little nauseous. If that were to happen, let me know. We can stop for a little bit, let you overcome that, and then we'll try it again. If this is something that persists, we'll stop and we'll wait for a better time to come back and try this, okay?
Okay.
All right, so go ahead and make a good seal. There you go. Breathe in and breathe out hard. There you go. Good job. All right. Really breathe out hard. If your abdomen or your chest starts to hurt, we can have you wrap this pillow. You can squeeze against this, against your chest. That will help give you some support. And really breathe out hard there. There you go. Good job. Excellent. Good job. Yeah, this exercise is really all dependent on you. The more that you can breathe out, the more effort that you put forth, the better results that we'll see, and you'll be able to get up, move around a little bit sooner, okay? So how you feeling? You dizzy or lightheaded yet?
I can't do it.
You can't do it. You can keep trying. There you go. Breathe out hard. There you go. You're doing good. Good job. There you go. Now you're reaching it. Excellent.
Can I rest for a second?
You sure can. Hey, you were doing really good. All right.
Okay.
Yeah, we'll be doing this, like I said, about every 4 hours. We'll come in, we'll help you try and reach your goals here, and once we see that your oxygen starts climbing, you start hitting these goals a little bit more, we can probably step you back down to the IS and see if we can continue with that.
Okay.
Sound pretty good?
All right.
So, like I said, though, this is pretty effort dependent on you. The more effort you give, hopefully the more results and better results we shall see.
Would it be better if I were standing up?
No, we don't want you to stand up. We also need you to cough occasionally in between here, okay? Go ahead and try cough for me.
Just cough?
Yep, just like that. There you go. How's that?
Okay.
Good job. All right, let's go ahead and continue this. We've got 3 more breaths on this to do. There's 2. Good job. Excellent. That was 3.
Okay.
That was the end of that. Well, you did really well on this. Looks like we stayed up with your heart rate. Everything's good right there. I'm going to go ahead and take this so that I can listen to you. Okay. You feel like you understand why we're doing this exercise?
Yeah, make me breathe better.
That's right. And especially since after your surgery and everything, we want to make sure that your lungs are staying healthy and keep away the atelectasis and pneumonia.
Okay.
Okay? Like I said, we'll be back in every couple 4 hours. We'll be doing this with you again.
Okay.
Do you have any questions or concerns?
How long do I have to do this?
Well, until we start seeing some improvement, and we'll start to see improvement when I can hear better aeration in your lungs, when I see that you're reaching your goals for the most part, and your oxygen starts to climb. So once that starts happening, we'll be able to step you back down to the IS that you were doing earlier.
Okay.
Okay?
Okay.
And then once that's been going well for a day or 2, then we'll see what the doctor says.
Okay.
Okay?
All right.
All right, then I'm going to take this off your finger now. Do you have any other questions before I leave?
No.
No? Okay. Well, John, it was nice working with you, and I wish you the speediest of recoveries. If you have anything else, you can give us a call.
Okay.
All righty?
Okay.
Well, take care.
Thank you.
See you.